So here at Optimum Therapies, we have a technique called dry needling. There's been a lot of discussion about what is dry needling and what is the difference between dry needling and acupuncture. And I'll tell you the similarities are acupuncture and dry needling use the same acupuncture type needle. It's a very thin gauged needle. Kind of the difference is dry needling is working specifically on those muscles that just seem to have a lot of trigger point tightness, and you can try and massage them and they're just stubborn. No matter what you do, they're just not going to shut off. They're really highly reactive and irritated. So dry needling is palpating those muscles as a therapist and then identifying it and then putting the needle directly in that muscle to, in essence, create it to reboot or to, like you're knocking off a breaker switch, you're just resetting the trigger point zone in that muscle. Different from acupuncture, where acupuncture is dealing with muscle energies in your chi, and it's working along meridians that are common to the body to affect energy flows. Dry needling goes directly to the actual muscle and works specifically right at that muscle. And here at Optimum, we do a technique called dry needling for that. So I just kind of want to demonstrate a little bit here along the shoulder and the upper trap. So the needle is set in a small sleeve, and I just go in and I identify where this, and you can feel these, where the sensitive spot is into the muscle. And then I'll just go in and I'll just kind of create, and I'll drop that needle into that muscle. And usually there's a twitch response from the muscle. Sometimes you'll visually see it, but I'm just kind of palpating and waiting in that muscle just for that muscle to finally just relax and shut itself off. And we'll do a series of these. We may work all across the shoulder depending on what the patient brings in or how flared up they are. A lot of people get a lot of periscapular pain, a lot of upper trap kind of pain. So we'll just work around this upper trap. If their rotator cuff is involved, we may be working along the back of the shoulder, maybe even a little on the front of the shoulder, and just trying to deactivate those trigger points so that we can gain better motion initially, and then with better motion, now we can start to work on if there's strength deficits or stability deficits within the shoulder blade. So just a real simple demonstration of what dry needling is. And I can probably tell you from our wonderful volunteer, Kevin, he probably didn't feel anything as that even went in. Yeah. So just a quick example of Optimum Therapies dry needling techniques.